Guys, okay, so in this injury breakdown, I'm gonna go over whiplash, and yeah, so before I start, I'm gonna just explain a couple of things so you guys understand. So we break down the body parts into the movements, okay? So in your neck, you've got 4 movements. You've got, so it's called the cervical, or to keep it simple, or and shortened is C-spine, but to keep it simple for you guys, I'm just gonna go by neck. So when I bend my neck forward, that is neck flexion. When I bring my head back, that is neck extension. When I turn my head to the side, that is neck rotation. And when I side bend my head, my neck, that is side flexion. So, all right, so whiplash, who hasn't had it, right? Or you know someone who's had it. So let's go with a scenario that you are seated at a red light, you are stationary, your car's not moving, and all of a sudden there's this person that comes up behind you and they're going fast, but luckily you have your seatbelt on, right? And your seat is not reclined, and it's upright, and that your head is close to the headrest, right? Yes, I know you guys are doing that. I trust you do. All right, anyways. So you've got your seatbelt on and you get hit. All right, well, here's the thing. Here's where physics is kind of mean. So the kinetic energy, the moving energy from that vehicle is going to transfer from that one that just hit you to your non-moving vehicle, which is why your car would move forward, and it's going to send those forces into your vehicle. Well, you're not attached into this vehicle technically, right? You're not bolted in, so your body's going to experience some of those forces. So here's the thing, misconception: when you have whiplash, your head is actually not the first thing to move. It's actually your torso, your trunk. So that's this segment here, okay? So your trunk and your shoulders are what move forward. So when you get hit, okay, your body's gonna go forward like so. But your neck is going to be staying, because your head is a bowling ball. It's like 3 to 5 pounds. So that bowling ball is going to try and stay where it is. It's gonna try to resist this inertia. But because the neck is attached to the shoulders, well, guess what? It's gonna try and pull forward, but the head is pulling you back. And so you end up having your neck going into the lower part of your neck into neck extension. Now here's the thing, your whole body's going forward, or the big chunk of your body's going forward. Well, guess what? Physics takes over, and then boom, your head snaps forward. So you are go from neck extension to neck flexion. Okay, so that's why sometimes the curve in your neck can be affected and changed. Okay, and then when you, obviously, that momentum's going to go somewhere and you're strapped in, so it's going to pull you back. Your head, okay, so here's the thing, your maxilla is the top part of your jaw that is attached to your head. Your mandible, which is your lower jaw, that's not. So that has its own inertia, it's got its own movement. So when your head snaps back, your jaw is going to have its own movement, its own timing, and it's going to actually it's going to have a little bit of a lag. So that's why when you see someone getting hit, they go like this, right? And then back, because their jaw is lagging and it's got its own time frame of when it's going to happen. Now, but here's your crazy thing. So it takes your eyes, it takes your body 300 to 400 milliseconds to blink, okay? To experience all of those movements for whiplash, it is about 500 milliseconds. So from studies and whatever they've done. So if you're wondering why you're in so much pain, there's a lot of things going on, and that's why you guys gotta make sure you keep the seatbelt on, make sure that your headrest and everything is lined up nicely, that you're not reclined, you're not trying to be all cool and lean back as far as you can. No, that's not cool, because your body's gonna hurt. So make sure that you guys take good care of yourself, that you're properly positioned, and that way you can reduce the likelihood of experiencing a lot of pain from having whiplash. Okay, so good luck, and yeah, safe driving. Bye guys.